My name is Dr. Terrence Baker. Today I'm the host of NABN TV's Doctors in the House. We have a distinguished guest with us today, Dr. Anthony J. Cannon from Temple Healthcare, trained at the well-known Cornell Medical School, did a residency at Bay State Medical Center, and completed special training, extra training, called a fellowship in endocrinology, that is diabetes-related diseases at Temple University here in Pennsylvania. He's board certified in internal medicine and has specialty boards in endocrinology, diabetes, and several other related medical topics. He's been president of the South Jersey Medical Association. He's been a fellow with the Academy of Medicine here in New Jersey, and he also is a speaker and guest to this show, Doctors in the House, at NABN TV. Welcome, Doctor. Today we're going to be discussing diabetes and been doing some education to our audience as to what is diabetes. And so today we'll get started with what is diabetes and how would a patient know that this is a medical condition that they have? Now, you mentioned insulin. What is insulin? Where is the pancreas? You mentioned this organ in the body called the pancreas that makes insulin necessary to regulate blood sugars. Where is the pancreas? And are there different types of diabetes? Sometimes you hear the term type 1 and type 2 diabetes. Is there a difference between the two? Are there certain medications that your doctor can put you on, like steroids, prednisone, or other medications that can sometimes take you from being pre-diabetic to actually having a condition of diabetes? Are there medical conditions that can predispose you? You talked a little bit about genetics, that is diabetes running in some families. Are there other conditions besides genetic conditions, that is conditions running in your family, that can predispose you to diabetes, other medical conditions? Very well. If I understand you correctly, here in the United States, as well as a growing number of patients in Europe and Africa, are experiencing new onset diabetes as a result of their environment, where they are not eating, they're not eating the same or not eating correctly, balanced diets. They're not exercising the way that perhaps they used to because more and more jobs are sedentary, and they're gaining weight well beyond basal metabolic rate, BMI rate of 30, and they're predisposing themselves to having difficulty with glucose metabolism. Would that be a fair assessment? I want to thank you for being with us today. Before we conclude our time together, I wanted to ask you a question about COVID-19 and SARS-CoV-2. And do you anticipate, as a result of this pandemic, that we're going to see more diabetes or that we're going to see more diabetic problems? What are you seeing in your practice? Today, I would like to talk to you about treatments that are available for diabetes. We've talked about type 1 diabetes, type 2, type 3, gestational diabetes. Could you teach us today about the management of diabetes? Thank you. Now, you mentioned that all diabetics require a diet, and we're going to be having a dietitian come in to teach our audience about a proper diabetic diet and what that might look like. We're going to have an exercise physiologist talking about a program of exercise, which all diabetics need to incorporate into their life. But you mentioned medications, and you're an expert in choosing the right medications for the right patients. Can you tell us a little bit about the difference between medications by mouth and medications like insulin by injection?
Sure.
Very well. I want to thank you, Doctor, for being with us today. You've been very informative. This is NABN TV, Doctors in the House. Thank you.